You probably think of lung cancer as a smoker's disease. We have all heard the warnings that lighting up skyrockets your risk. And while that is certainly true, the truth is lung disease is not exclusively a smoker's problem. Talking health with me this morning is Dr. Scot Ackerman with the Ackerman Cancer Center. Good morning to you. This is a subject that so many people are going to be interested in hearing about because we have all lost loved ones, whether it's family members or friends, to lung cancer. It's a sad reality. And we think about smoking, but many more risk factors there.
Well, many more risk factors. In fact, 20% of lung cancer patients never smoked a single cigarette in their lives. And we're seeing more and more non-smokers developing lung cancer. Now, part of that is less people are smoking, and so you're going to have a disproportionate number of non-smokers in that group that have lung cancer. So now we're focused in on those risk factors that non-smokers would have to developing lung cancer. And those risk factors, the one you think of automatically, the one that we've always been talking about, and I've talked about on here before, is secondhand smoke. And secondhand smoke is because you're living with someone who's a smoker, you're inhaling that smoke for many, many years. We even talked about third-hand smoke before, which is when the smoke gets in the clothes and furniture in someone's house.
Wow.
That in and of itself can increase your risk of lung cancer. But also in lots of houses, there's radon gas, and we measure for that. Radon gas is in the soil and the groundwater, and that gets into people's houses, and that could increase your risk of lung cancer. There's carcinogens in the community. There's asbestos exposure. People that used to work in the shipyards here in Jacksonville.
Yeah.
That I see they're older now. They're in their 70s or 80s. People that when we had the shipyards were very active. They're getting lung cancer at a disproportionate rate, and many of them smoked, of course, and that it works synergistically with the asbestos, but many of them never smoked. And then pollution, air pollution, diesel fumes, all that, and thank God here in Jacksonville, we have a nice sea breeze frequently, and I think our pollution levels are pretty low. But in lots of cities, there's a lot of pollution, and internationally, if you look worldwide, lots of cities, Delhi and cities in China, the pollution is huge. It's a huge issue, and there's increased risk of lung cancer.
And I want to ask you about how we can protect ourselves. Everybody wants to protect themselves, their children, the future generations. Obviously, don't smoke. Try not to be around people who smoke. But what else can you do as far as diet, exercise, and healthy choices?
Well, you want to be healthy choices. You want to make sure you eat well and you avoid these carcinogens I'm talking about. Check for radon gas in your house, those sort of things. Avoid pollution. All those things can help you minimize your chance of developing lung cancer. But lifestyle changes like diet and exercise don't really help with lung cancer.
Really? Okay.
But you need to be aware of symptoms, shortness of breath, cough, trouble breathing, so it can be diagnosed early. And if you're at risk for lung cancer, if you have a history of smoking, then there's screenings that we could do. And so I talked about non-smokers. They need to be aware of the symptoms, cough, shortness of breath. But smokers, there's screenings that could be done for them.
Dr. Scot Ackerman, thank you for your time coming in on behalf of the Ackerman Cancer Center. We appreciate what you and your team do every single day.
Thank you, Vic.